Hello everybody, welcome to Onyx Coale's YouTube channel. My name is Sierra, for those of you who don't know me, and I am her daughter. So today's video is extra special. This is going to be a Zoom call with a couple of our leaders, which would be Marci, Preble, and Peter No, who are both SPDs out in California, who are such lovely people, and if you don't know them, you should know them. They are wonderful. And this is a big Q&A session with David Schmidt, who is the CEO. He's the scientist, he's the founder, he's the inventor of LifeWave and of X39. So we love having him and we love being able to pick at his brain. So this is a great Q&A session with everybody there. If you enjoyed this video, make sure to like the video and subscribe to Onyx Coale's channel. If you do subscribe and are one of our first 1,000 subscribers, we're giving away 9 free sleeves of X39. So if you want to be on that list, make sure you hit that subscribe button. Besides that, enjoy the video.
Hi, welcome to our X39 review with interview today with Marci and Peter No. We are so excited today to have the David Schmidt, owner, inventor, and CEO of the LifeWave company. I'd like to tell you a little bit about him. David is the inventor of LifeWave technology, founder and CEO of LifeWave. David's experience in business and product development spans over 30 years. As a result of his many innovations, David was presented with the honorary International Hall of Fame for Inventors. The LifeWave technology was born out of 3 years of intense research by David into the concept of being able to naturally increase energy and stamina through the elevation of fat burning, utilizing a wireless communication that works through the human body called phototherapy. My guess, and I'm getting chills, is that was most likely the energy patch. And all I can tell you, I gotta start wearing that one. The LifeWave technology is now available to the public. David has committed the past 15 years into making his opportunity a reality. Globally, David holds 94 issued patents, 13 pending, and more than 70 of these patents are in regenerative science. One of his inventions found he could improve wound healing that rivals that of stem cell injections. This led David realizing that phototherapy can be a means to which a person's own stem cells can be activated into a more youthful state, as opposed to requiring an injection of expensive and potentially dangerous stem cells. Hence, after 10 years of study, the X39 patch was born. Today, David is in 100 countries and has offices in the United States, Ireland, Japan, and Taiwan, with warehouse and distribution throughout the world. LifeWave has been a multiple recipient of the Inc. magazine's list of the fastest growing companies. Wow, that is our leader. Pretty amazing. Peter, why don't you go ahead and take over and start with David. Thank you.
Thank you, Marci, for that edification of David Schmidt. And David, before we get started, I'd like to do a huge shout out because the last time that we saw you here in Orange County was in December, and we just got barely started. We had about 150 people at that event, but I just want to update you now. In the last 7 months, we have literally grown to over 3,000 members and partners here.
That's amazing.
All the way from Temecula, Linaloon, to Suzanne, Sally, SoCal, Juliana, New Mexico, Geraldine in Colorado,
what am I doing?
Savi, Dr. Harmon, and the Doctors Group in Idaho, Patrick Jackson, Vegas, our Alaska team, Hawaii team, Houston team, Kylie Bob in Florida, Barbara in New Zealand. I just want to name out if I missed you. I just want to know, David, we are so excited to have you here today. and just
Thank
want to
you,
do
Peter.
a
That's
huge shout out.
incredible, and congratulations on your success. And really excited and looking forward to today. We're going to cover a lot of ground, and I know a lot of really interesting and exciting things. So I'm very much looking forward to it. So thank you for inviting me on.
Oh, thank you so much. And we're just going to go straight right into it. Okay, David?
All right.
So what is your background? Who are you, and why did you start the company LifeWave?
Okay, so my background. I went to college and to get a degree in management, biology, and computer science. And when I got out, I was doing research and development into different types of medical devices. So these would be class 2 medical devices. And I did this for a few years, and it gave me a really good education into what it was like to be in an environment of developing products. I then went on to have several companies of my own. And I was living in New York, New Jersey area where I grew up. And I moved down to the Atlanta, Georgia area when I was in my 30s. And when I moved down there, it was to open up a computer business. But I wanted to stay in touch with inventing. So I joined a inventors club. And I developed a number of pretty interesting things, new types of batteries and fuel cells. And I got approached by a group of guys that wanted to see if we could commercialize some of the technologies that I had developed. So we got together, and because of their contacts, we started to develop new technologies for the United States Navy through government contractors. And I was invited to, after a few years, I was invited into a project where the Navy was creating a mini sub. And for the US Navy, a mini submarine is about 60 feet long. And it attaches to a nuclear missile carrying sub. And the crew of the mini sub were Navy SEALs, and they were going on really long missions. So I had invented something that was considered by General Dynamics to be impossible. It was a new type of oxygen supply. And so they said, hey, the guy that was the head of this project said, hey, I really like that you're an out-of-the-box thinker. This is a mini sub we're doing. Could you see if you can make a contribution to it? And so I thought, well, these guys are going on missions that are 30 hours, 60 hours long. They have to stay awake. Maybe there's a better way that we could keep them awake instead of putting them on caffeine or amphetamines. And that's when I began to think about, well, what if we tapped into the way that the body naturally makes energy? Is it possible that we could have some type of wireless communication device that would cause the cells of the body to make energy? And this was the very, very beginnings of LifeWave and the energy patches. And of course, the way that this turned out was I found a way to use specific combinations of light to activate the mitochondria in the cell to increase fat burning. And this has been the basis for how all the LifeWave patches work. And over the years, especially recently, the technology has become very sophisticated in how we target different regions of the mitochondria and produce some really incredible effects when it comes to regeneration, longevity, and even age reversal. Oh, I'm sorry, Peter, you're on mute and I can't hear you.
You need to unmute yourself.
Sorry. Would you say that was your inspiration to create all this technology? Did it start from there, or did you have another inspiration for all this technology?
Well, that's a much longer story. It actually started many, many years before that. I was going to graduate school at Pace University. I was working towards a graduate degree at Pace University, and I approached the chairman of the biology department because I had an idea about how to selectively destroy cancer cells. And if you were to see a healthy cell, let's say it's got a big electrical charge around it, and a cancer cell is smaller and has a smaller electrical charge around it. And I found a way using basically electricity and magnetism to target cancer cells without harming healthy cells. And I was working with 2 different tumor lines that were neuroblastomas. And I did this in conjunction with the Children's Hospital of Philadelphia. But anyway, that had set me on this early course when I was in my 20s of looking at the body much more as a bioelectrical or biomagnetic organism. And we should be looking at health as we need our foundation of water, proper nutrition, and exercise, but we don't have to rely on drugs for healing. We should be looking at the electrical and magnetic properties of the body and working with that to get optimum health.
And David, what would you say is your vision for healing humanity then, because of this technology you're coming out?
So the body works on the basis of light. What's so interesting about this is that for thousands of years in cultures all over the world, it has been recognized that we are light beings, that we are much, much more than a physical body. And actually our physical bodies are the least important aspect of really who we are as human beings. The spiritual component is by far the most important component. And that's why spiritual healing is so powerful. And people that are legitimate spiritual healers, it's far superior to any type of medicine. But when we recognize, the true identity of what human beings and the world around us really is, we recognize that, and in biological terms, it's light that's governing our very existence. One of the premier researchers in this field was Fritz Popp, and he was the first one to actually document that human beings, animals, even plants are emitting light. So the age that we're living in now is that we finally have the tools and the resources that we need to develop technologies based on light that can heal the body in very, very powerful ways. So that's the path that I see going forward. Light therapy will become a bigger and bigger part of how we heal.
Oh, great. And would that be part of your, tell us, what is your 15-year journey in building your company, David, with this light therapy technology?
Yeah, so actually it's really pushing closer to 20 years. You think about it was several years to develop the technology, then it was another 2 years to try to figure out how to manufacture it and to put together clinical studies to support what it was that it was doing. And then we launched the network in 2004. And so then, of course, we celebrated our 15-year anniversary at market with this last year. But this is, Peter, this has been an amazing journey because when we started, it was just simply about, let's give people a way to improve their energy without having to use drugs. Then as the products developed, it was, let's give people some anti-aging products, things that are going to reduce stress, detoxify the body, and protect the body so we can have a healthier future. But over the past 10, 12 years, my focus has really been more on regeneration, longevity, and age reversal. Because the biological mechanisms now for doing all of this is being accepted and well understood. So what this means is that X39, we can talk about this a little bit later, but X39 is the beginning of our entry into stem cells and regeneration, and it's not the end. It's the very beginning of the story, and the future and the path that's taken us here is leading us to a place where lifespan is going to reach levels that used to be considered science fiction, but it's becoming real in the laboratory today.
Actually, that will actually lead us to our next question is, how did you come up with this X39 stem cell activation technology, and how long did it take for you to perfect it?
Yeah, it certainly didn't happen overnight. It was about a 10-year journey. And actually, when I started, I was trying to find a way to activate stem cells with electromagnetism. And I hold about 70 patents in this area today. And so there was quite a bit of technology that came out of this research. We spent just over $4 million over that period of time developing this. But essentially what we learned how to do was create these devices that, with a combination of what's called an electromagnetic field and a longitudinal field, influence the activity of the stem cells in the body and get the stem cells to function as if an injection of stem cells had been given. So we had worked with the National University of Ireland on this, and their research center on the west coast of Ireland is in the top 2% of research centers globally when it comes to stem cells. So we got this research collaboration with NUIG. We got a research grant from the government of Ireland called Scientific Foundation Ireland, and we began doing this research. And we did our basic cell culture studies, we did animal studies, and then human studies. But we found with this technique, I'll give you one example. We took 30 people, and each one of these people, they had diabetic or idiopathic neuropathy, meaning that the nerves in their feet were destroyed and they were developing neuropathic symptoms, they were in pain, and they were at risk for amputation. And we were able to, in a 8-week period of time, regenerate the nerves in their feet and reverse their diabetic neuropathy. And there's no drug or therapy in the world today that will do that, but we figured out how to do it. And that really led to the development of this understanding that we can use energy, and bear in mind, light is high frequency electromagnetic energy. We can use electromagnetic energy to influence the stem cells without having to give a stem cell injection.
I mean, this technology, David, I mean, for all of us, it just seems like so far out, but we cannot believe today, I mean, the science is here. Can you tell us a little bit more? What is behind the science of the X39?
Yeah, that in of itself is so interesting, because our bodies are actually designed to be powered by light. Now, we often think of sunlight as causing our bodies to make vitamin D, and that's absolutely true. But it's only a very, very small part of the picture. About 10 or 15 years ago, it was discovered that when you put specific types of light on the skin, and it could be infrared light, which we can't see, or visible light, that it will cause real chemical changes in the cells. And for those doctors that are out there, or those people that are curious, it causes an increase. Light will cause an increase in an enzyme called cytochrome C oxidase. And what's important about this, and what's so telling that we're beings of light, is that this is a component of what's called the electron transport chain in the cell. And this is how our bodies convert food to energy. So what this literally means is that our bodies can absorb light and respond in such a way to turn that light into additional energy. So with LifeWave technology, what I found that we could do is take a combination of different types of organic materials, process them to form crystals, and have these crystals engineered so they will reflect different wavelengths of light. When you put the patch on, these wavelengths of light stimulate the skin. They'll upregulate the mitochondrial energy production, and they'll also, I'm trying not to get overly complicated with this, basically the patches will stimulate the skin with light and change the metabolism in such a way so that we can cause the synthesis of specific signaling molecules, peptides, that will cause a desired reaction. So in the case of X39, we use the patch to stimulate the skin with light. This causes an increase in the peptide GHK, and then this regulates stem cell activity in the body.
It
That's the
sounds
light.
so.
That's the light version of it, so to speak. It's way more detailed than that. So,
Well, David, I mean, we've been building our business here because we've been keeping it so simple. I mean, it's really, but when people hear about light therapy, photobiomodulation, this technology now, we cannot believe that we hold this in our hands because of you. And I can't wait to see what's going to happen in the future and all this other technology where it's going to spawn off of.
yeah, it's exciting. We had a leadership call today where myself and Jim Caldwell, we were speaking with the leaders and giving them a little bit of a glimpse into what's coming into the future. And, you know, the most about what I could say, again, is that X39 is the beginning of the story, not the end. There are more products in our future that will lead to better ways to heal and regenerate. And again, you know, my ultimate goal is I personally don't want to age, and I would like to be younger, and I would like to be able to, you know, share those gifts with our members. And all the research that we're doing is indicating not only is this possible, but it's totally achievable. And we see these effects in human beings.
You know, it's a great, you know, when you can share a picture of your CEO that is the product of the product. And I get a lot of compliments from you because they're like, oh, your CEO looks pretty young. That means the product must work. I'm like, I hope so. He created
I appreciate that. You know, I turned 57 in April. And, you know, one of the blessings out of this pandemic is I've been locked in a house where I built a gym and I've got a lot of protein. And, you know, so I would say that based on the numbers, I'm in better physical shape today than I was in my 20s, speaking athletically. And I know that the patches have played a huge role in that.
Can you give us maybe a list of what issues that you can say that X39 can really help with? What are just some of the issues?
Yeah, so that's a little bit of a tricky question to answer because, you know, we can't make any medical claims.
Yes.
And we're a general wellness product in terms of the FDA. So if we look at what do we claim the X39 patch does, it's going to activate stem cells. That's kind of like the core of what it does. If we dig a little bit deeper with that, X39 is designed to elevate copper peptide, and it does this through increasing the way the mitochondria produces energy. So that then would lead you to say, first thing is a big problem that people have as they age is mitochondrial dysfunction. And that means, so people are slowing down, they feel tired, more fatigued, and that's going to be a big problem that X39 is going to help to alleviate. Now, interestingly, the process of healing is intimately connected with the quality of sleep. And we had a clinical study that was done by Dr. Melinda Connor, and we've done blood studies and also urine studies. And one of the interesting things that comes up is that X39 also improves the quality of sleep. So people that are having a problem sleeping will benefit. And this is because X39 will elevate production of something in the brain called GABA.
Just want to put the plate because I was
Yeah, put it up.
Give us 1 second.
No problem.
Okay, we're good to go.
Yeah.
Yeah. Now, another thing that happens is copper peptide, when it's elevated with X39, copper peptide, its most powerful attribute is that it's able to modulate gene expression and reset about 1/3 of the genome back to a younger state. And one of the things that occurs is that this helps to manage inflammation. And if we look at, you know, we could do an entire webinar on just why is it that people age, and so how can we reverse aging or prevent it. But inflammation has a lot to do with this problem. As people age, their ability to manage inflammation declines. And so X39 will help that. So obviously, you know, people that are suffering with some type of chronic pain can benefit from X39. Another thing that happens is X39 will increase production of the intracellular antioxidant glutathione, which is the body's master antioxidant. And it increases it by levels of between about 30 and 40%. Again, we've seen this in our urine testing. Advantage to this is that the age of the cell is intimately linked to the body's levels of glutathione. And glutathione normally declines with age. Glutathione is also neuroprotective, meaning when people develop Parkinson's disease, it's actually from a deficiency of glutathione. So one thing that we want to be concerned about is we want to keep our glutathione levels elevated, because this will protect the liver, it protects the nerves, and it protects just about every cell in the body. And then the really big one, of course, is that when we activate the body's stem cells, it's good for just about everything, you know, without getting into some disease claims and others. So yeah, X39 by far is our most powerful product, and it's really good for the health of the entire body.
Well, I'll tell you for sure, we all have benefited from X39 in many ways. And David, it's been an honor and my pleasure to be interviewing on my part. I'm going to pass it on to my partner, and Marci, she'll take over. And thank you for all those incredible answers, as I think everybody saw the value and heard it straight from you today. So Marci,
thank you, Peter. It's been a pleasure. Thank you.
Yeah,
You're
it's
welcome.
amazing. The science behind this technology is groundbreaking. It's innovative. So David, my question to you is, what are some of your other favorite patches that you've created, and why?
Well, you know, I would say the energy patch, of course, since it was the very first patch, is always going to have a special place for me, because it's what really kicked off everything. But if I would have to say what's my second favorite patch after X39, I'd probably have to say it's Eon. And Eon has a really incredible story, which I can only tell apart, because I wouldn't want people to make claims about it that we don't authorize. But long story short, I was at Suzanne Summers' house, and I was having dinner there with a group of scientists. This is what I like to do for fun. I hang out with old scientists, and so I'm pretty boring socially. So, but I met a scientist there that I had wanted to meet for quite some time. He's very well known, and he had been doing research into natural types of cancer therapy, and actually molecules that the body produces in an attempt to fight and suppress cancer cells. And he is also very, very interested in longevity. So he did this experiment, and he wanted to know, and this is really the way science works, is we ask questions about the natural environment. And he was seeing that the queen bee was living 50 to 60 times longer than the worker bee. So the question is, why is that? Genetically, they're nearly identical. So what's the difference? And he found out it was the food, and that the queen bee is the one that's consuming the royal jelly. And in the royal jelly, there is a specific peptide that regulates inflammation and allows the queen bee to live so much longer. So he isolated this peptide. He injected it into a worker bee, and just one injection of this peptide allowed the worker bee to live 5 to 6 times longer than normal. So now he said, okay, well, can we apply this to human beings? And remarkably, he found the same chemical exists in human beings. So we say, well, why don't human beings, live, a couple hundred years? And interestingly, the reason is because this peptide is produced in the liver, and it begins to decline at about age 30. So we lose the advantage of this. So I began to look at finding, well, if this is already a peptide that exists in the human body, maybe we could find a way to turn it back on. And that's what the Eon patch became. So the Eon patch elevates this peptide. And what we found, we did about 9 clinical studies on it. And what we found in our testing is that it is a broad spectrum anti-inflammatory. It will reduce inflammatory cytokines, C-reactive proteins, homocysteine, lipid peroxides, fibrinogen. So that was it. That's one of its main benefits. We did another clinical study with Dr. Tom Budzinski, and Dr. Budzinski and his wife, Helen Budzinski, another PhD. They found out that within seconds of applying the Eon patch to the body, that it would bring the autonomic nervous system into balance. And this is why when people wear the Eon patch, first it reduces the stress on the nervous system, and then it begins to elevate antioxidants and reduce inflammation. So Eon patch, for many years, not surprisingly, was a top-selling product. And I love it because it not only do people get the daily benefits of the product, but there are some very, very serious longevity benefits to using Eon as well.
Wow. So just so you know, this is it, you guys. We might all want to get that one.
Yep.
And of course, this is what he was talking about. The energy patch was the beginning. And then, of course, the powerful X39. David, is there one other one that you want to talk about? You have one other one?
There is actually. Carnosine, to me, is one of the most underrated patches we have and underrated nutrients. And I began looking at carnosine back in 2005, 2006, before it ever started gaining attention as a nutrient that can improve sports performance. And today, its precursor, beta-alanine, is relatively common. You can get this now at GNC and those type of things. But back in the day, one of the benefits of carnosine was that it was increasing lifespan in animal testing, like in mice and rats, by 30 to 40%. And back then, nobody knew exactly why, but today, now we know, is that carnosine has the remarkable ability to protect the telomeres from shortening. So long story short, telomeres control the number of times the cells will divide, and we elevate carnosine and it slows down that process. So if it translates the same way, as human beings here, just by on a daily basis elevating carnosine, we can potentially increase our lifespan 30 to 40%. But it actually is much, much better than that. And the reason is that we began looking at, okay, well, increasing, the lifespan up to 130, 140 years might be too much for people to wrap their arms around. What benefits can we get today? Well, carnosine is stored in the brain, the heart, and the muscle. And so we worked with a pharmacologist, Dr. Lisa Tully, and she did a study and found that after a month of using carnosine, people were getting very significant improvements in their strength, their stamina, and overall measures of physical performance. We also did a study, again, with Dr. Tom and Helen Budzinski, and we looked at the phenomena of age-related cognitive decline. And we found that we could take people over the age of 60 and actually restore their long-term and short-term memory, restore their focus, and even the speed at which their brain was functioning was improving when we elevated carnosine. So carnosine to me is an amazing, simple nutrient that people can use to extend their lifespan, but most importantly, improve the quality of their life today.
Wow, I did not know that. I'm putting that on
Okay.
today. I did not know what we had our hands on. And I guess I just want to know, and then just one more. What's your fourth favorite? And then I won't ask anymore.
Oh, brother. Well, that's going to be tough. That's going to be tough. It would probably be a toss-up between glutathione and Aloe Vera.
But will you say why for both?
Yeah, well, I mentioned it before, lifespan is intimately linked to our body's levels of glutathione, but one patch that I will not travel without is glutathione. And just a short story, I was down in Mexico at a leader event a few years ago, and I cut my foot. I got a new pair of sandals. I thought it would be, I get these new sandals so I could enjoy the beach. And they ended up scraping the top of my foot, and I got an infection within the first day that I was there. And I happened to surround the infection with the glutathione patch. I used 3 patches around the infection, and within 24 hours, it was gone. Mm-hmm. So glutathione, that's just one example. Glutathione has saved my life a number of times. Now, the Aloe Vera patch, I've had some amazing experiences with it, but it's designed to elevate the peptide epithalamine. And this is a peptide in the pineal gland that was discovered by a Russian scientist by the name of Kavinsky. And what's remarkable about epithalamine is that it's been linked to telomere regeneration. And so he has spent his life looking at ways to reverse aging and extend lifespan. And he has said that the secret behind this are in neurohormone precursors that reside in the pineal gland. And he's isolated epithalamine as being one of the most important ones.
Wow. You know, I just started wearing Aloe Vera a month ago, and I don't know, but I've just noticed ever since I started wearing it, my skin is even softer than it has been. You know, it's just amazing.
Yeah, you know, when we look at, you know, again, when you want to look at how to solve problems in biology, you try to find something in nature that will give you a clue. And in longevity research, things like lobsters are looked at because they produce infinite amounts of telomerase, and actually as lobsters age, they get stronger and their immune system gets better. And lobsters can live, you know, 130, 150 years. It's actually their shells kind of prevent them from living longer. Clams have been found to live up to 500 years old. And so, you know, the basis for this then is scientists that are looking at longevity and research. The telomeres play a really critical role in this, as does oxidative stress. So if we say that Aloe Vera is helping to lengthen the telomeres, which we don't claim, by the way, we aren't making that claim, but what we have found is that it reduces oxidative stress. And this is so critically important to our health and our longevity. So when you look at the cells in a lobster or a clam that's very, very old, they show no signs of biological stress. And that's what we find with Aloe Vera, is that it brings down the levels of oxidative stress.
Wow. So, David, what excites you most at this moment for your business?
Well, for the business, I would have to divide that between what's going on with the business and the products and the research. If we just looked at the business, I mean, it's incredible. Our sales in 2019 were nearly triple of 2018. And our sales this year are going to be somewhere between double to triple of where they were last year. So the rate at which we're growing is absolutely phenomenal. And of course, that's all happening because of you guys. You know, we have great leaders, we have great members, and they're really driving the excitement behind this. So that to me is exciting. We're expanding globally, and I can tell you that the executive team, we get requests weekly to be opening new countries. So right now we're opening Ghana, Nigeria, South Korea, the Philippines, Malaysia, Thailand. Those are all on the list to be open this year. And next year, we're looking at opening South Korea and Vietnam. And we have some plans to do that. So I'm glad Peter likes that. So yeah, it's what's so exciting about this is the massive potential in a country like Japan, where we started last January. We had about $150,000 to $200,000 in sales in January of 2019 out of Japan, and now we're up to $5 million a month in sales in Japan, and you know, we continue to skyrocket and grow there. So on the business side, the rate of growth is absolutely incredible, and it's exciting.
So what excites you most about the product side?
On the product side, I'm gonna have to be really careful. I don't give too much away. I don't want to, you know, spoil Christmas.
Okay, and if you don't want to, it can be a surprise. You don't have to.
It's my favorite subject, so it's going to be hard to avoid it. Yeah, without giving too much away, Jim Caldwell and I, we call it an embarrassment of riches, is we've been incredibly blessed over the past year with the progress that we've made in the lab, and we're turning out more products faster than we ever have before, all in the field of regeneration. We have one study specifically I am super excited about. I will tell you that, so there's a medical doctor that we work with who does independent studies, and we had this new product in clinical research for about 6 months, and I was sitting in a meeting and the email came through, and I opened it up and I looked at the results from the study, and I had to stop what I was doing because it was like a lifetime of achievement in that one moment. It was like, okay, I've literally accomplished what I set out to do with my life with this one study. And so we, like you would do with any project, you want to duplicate the results. This was a pilot study that involved 15 people. In a 6-month study, you're always going to have dropouts. So one of the people dropped out. So we had 13 out of 14 people get results with this product that would today be considered medically impossible. So that's a product that's going to be in our future. We went and started the second clinical study on this, and we're just at the 6-month point now. And so we'll be wrapping up a 1-year study with this by the end of this year. So we're super excited about that. I've also had some really great success at looking at very, very specific ways of targeting stem cells. So X39 is our broad sweeping product for activating stem cells in the body. But you know, you ask yourself the question, is there any way to maybe target stem cells more specifically? Like, could you target, what happens if you target stem cells to the brain, or you target stem cells to the muscle tissue, or, you know, something else? And so I've been fairly successful at finding ways to do that. I'm also going back and I'm looking at a product that I first prototyped in 2003, but the results at the time scared me a little bit, and I wanted to go back and revisit it. I had a wisdom tooth pulled, and I created this patch based on a very specific principle. And after about a month, I regrew half of the wisdom tooth that had been pulled. And so this is, and it wasn't designed to do that specifically. It was designed to regenerate something else. But it was the way that it was doing it that kind of triggered this reaction. So anyway, long story short, we're having a lot of success now in finding very specific ways to use stem cells that are complementary to X39, but yet different than X39. So you could kind of see in the years to come, X39 will continue to be our flagship product, but someone will say, I'd like to regenerate this, or I'd like to have the stem cells kind of go over here. We're going to use this patch. Or I might like to, it's hard for me to say anymore without giving away, you know, the store. but it's all to say there are going to be more patch products. There are going to be other products that come in, and they are going to be focused on newer and better ways to regenerate the body.
Wow. Pretty exciting. There's a lot coming, you guys. Wow, the technology.
There's a lot for the next couple of years to keep us busy.
We're at the right time, at the right place, with the right inventor and leadership. We are so blessed. So David, we've all wanted to know this. Why did you choose network marketing as your vehicle for distribution? And thank you, by the way, for doing that.
Well, that was, I think, divinely inspired, because at the time I really didn't want anything to do with network marketing. I had come out of some very traditional business models. And when I was getting started, I thought, well, maybe I will try to get this into a retail store like GNC, or get it on the radio. I was kind of thinking along that way. And I had a series of events that occurred in my life where I met somebody, and then they introduced me to somebody, and then I was speaking with a doctor, and he was telling another doctor about it. And then I ended up speaking with Richard Quick, who was a 6-time U.S. Olympic coach and the coach of the Stanford University swim team. And I got the opportunity to visit Coach Quick and apply the energy patches to the Stanford women's swim team, which was an amazing experience. And in the first 3 weeks, we had 6 out of the 8 swimmers break their personal lifetime best in their event. Wow. And I realized that the way that I got there was through networking. And so I had been meeting people saying, you've got the perfect product for network marketing. And eventually I realized that was true. And so after 2 years trying to figure things out, in August of 2004, LifeWave was set up, and November of 2004 was our first month as a network marketing company.
Wow.
Yeah, it's been great ever since.
We are so glad that you realized that networking is how you met everybody.
Me too. Oh yeah, me too. I'm very grateful for that.
So why do you think that right now, in this particular moment in time, that LifeWave is a good business opportunity for creating financial security, financial abundance for the many?
Yeah, there are a lot of reasons for this, and many ways that you can answer this question. Just yesterday, I was speaking with a very well-known network marketing attorney in the United States, and he had said to me that all of his clients were telling him, and he only has network marketing companies as clients, was saying that business across the board in our industry is booming. And the reason is that everyone is being forced to stay at home. So there's more people in front of their computers. The economy's been devastated. So people are looking for alternative levels of income. And, of course, here in the United States, the unemployment rate is horrific. So people need money, they're stuck at home, and this is the best time ever to be building a business and having a home-based business. So that's one factor. Secondly, healing has never been more valuable than it is today. We are faced with challenges today that as a species, we have never had to deal with before. So these are things like genetically modified foods. We have engineered foods, which is a whole other subject. We have all types of pollutants that are around us. We have electrosmog, we have 5G. So all of these things are applying pressure to us biologically, and we have to meet this challenge with new technology that's going to support the integrity of our health. So this is one of the many reasons why LifeWave is a great choice. Now, if we just were to focus on X39, for sure, 20 years from now, stem cells and stem cell therapy is going to be commonplace. But today, stem cell injections are extraordinarily expensive, And they're not at the level of sophistication yet where they can really provide people with the type of healing that, that they'd be looking for from this approach. But yet we have a way very inexpensively, very safely of activating the body's natural systems by activating the stem cells and helping to support overall healing. So there's not going to be any other place where people can find a better way and a less expensive way of taking advantage of stem cell technology than with our products.
Wow. And we were considered an essential business. Is that correct? And why were we considered an essential business? And, you know, we all want to thank you. You know, when everything else was closing down, we were all still getting our patches.
Yeah, so we had to get a few different legal opinions on this, and I will tell you, this wasn't cheap. This cost us about $100,000 to do this, but we started a unpublicized study, which was performed at 2 different hospitals in the United States using our products as a prophylactic and treatment for COVID-19. So we were able to legitimately say, hey, we are providing our products to healthcare workers to support them during COVID-19, which was absolutely true. And that was one of our levers for allowing us to stay open. But it was very expensive for us to go that route, but obviously worth it. And then the other thing is because we were providing products that supported the overall health of people, that was another reason why we were allowed to stay open. So again, we were really fortunate that we were in that position.
Wow. Yes, thank you. So what do you see as the future for LifeWave, for you, for us as distributors with LifeWave? What do you, the future looks bright, it seems.
It certainly does. You know, first of all, I'm incredibly thankful that we have such a great leadership team. We get an opportunity to work with these incredibly great minds that have great experience in the industry, and we're always working towards new promotions, new resources, refinements to the compensation plan. We're looking at every possible thing that we can to stay cutting edge and have the best opportunity possible. We've been doing so many hires recently. People that have 15 to 20 years of experience in the industry are coming on board with us now because they see our growth and they love what we're doing. And then, of course, with the products, I'm really excited about what's going to unfold in the next couple of years. It's a challenge trying to think through how to launch these products, what's the timing, how do we want to do it, but it's exciting. So yeah, both on the business level, for the products, there's so much going on.
Wow. So do we have time, David? Are you able to take maybe 10 minutes of questions? Is it okay if we do a little Q&A?
Absolutely. Let's do it.
Okay. Thank you so much. So the first question, and if I could have Peter and Geraldine look at chat, you guys can add some of your questions in chat, but I do have a few people that emailed me ahead of time, so I'll start with those. A lot of people have been wondering we're pretty sure we're FDA approved, but we don't really understand fully what we are and what category, and everybody asks us that.
Okay, so we are not FDA approved. The FDA has 4 different categories, or actually 5, maybe you could consider it, but they have class 1, class 2, class 3. So class 1 might be something like a Band-Aid or a tongue depressor. Class 2 would be a medical device, and class 3 would be a drug. So that loosely the way to think about that. FDA also has categories for vitamins and herbs. That's the GRAS list, GRAS, and that means generally recognized as safe. Where we fit in is a category that the FDA created called general wellness. And general wellness is a category for things that improve the flow of energy in the body and do things like improve energy with people, improve the quality of sleep, and other measures of health. So that's the category that we're in. So this is not something that the FDA will approve. you self-declare, and we've been through FDA reviews since 2005 when we started, and so they've never taken issue with the way that we do things.
So when someone asks us, what do we say? Like, how do we stay compliant when someone says, are you FDA approved? How do we answer that and stay compliant?
Yeah, you could say we're FDA compliant, and we are recognized as a general wellness product.
Thank you. All right, so David, these are more specific questions, and if these are too specific for the call, please let us know, and I can just email those to you, okay?
All right.
But after 3 months of use, the X39 didn't improve my rosacea. Is rosacea, thank you. Is Aloe Vera recommended for this condition instead? So basically she's wondering what patch, maybe to, once again, we don't make claims.
Yeah, so that would be considered a medical claim.
Yeah.
What I would say is to use the glutathione patch actually, and try it out. And if after 30 days you should see a result after 30 days. And if you don't, just return it and you'll get a refund.
Thank you. Okay, and wow. So this question is, what is wow, X39, and is there a urination problem sometimes on it? Like you stop urinating when you're on it and you start urinating when you're off of it? Once again, that might be too specific, and that's okay.
Can I
address this actually the other way, is that typically what we see with any of the patches is that it increases the amount of urination. And the reason for this is that X39 or any of the patches, they increase the way the body produces energy. So when energy metabolism goes up, the amount of water the body needs goes up. And so as a result, toxins and other metabolic wastes are removed from the body. And so urination typically goes up.
Okay, wonderful. And then there's another question on liver and kidney regeneration, heart or brain, those kinds of things. X39 best?
Okay, so first of all, for the heart and the brain, again, without making any medical claims, we have clinical studies on both X39 and Carnosine showing they have significant benefits for the heart and brain. So if you go in the science section of the website, you'll see that we have a study on both X39 and Carnosine on cognitive function. Those are really impressive studies, so people can take a look at that. Also, Carnosine is known to be stored in the heart, the brain, and the muscle tissue. So if someone was interested in supporting the health of their heart, I would definitely recommend Carnosine. As far as the liver and the kidneys, the primary antioxidant in the liver is going to be glutathione, and you also find copper peptide in the liver as well. For the kidneys, that's interesting. I'm looking at a product now specifically for the kidneys. We're testing one. But short of that, I would say X39. And
wow.
Again, we're not making medical claims on regeneration. We're just saying supporting health.
And
hey,
yes,
Marci.
Yes, go ahead, Peter. Yes.
I have a good question. This is from one of our doctors. One of our doctors, Dr. DeHaas, he had a lot of people, people report that they got sick. Can this trigger a detox effect?
Oh, absolutely. Yes. And this can happen with any of our patches. And the reason for this is that the patches will trigger an increase in fatty acid metabolism. It's called beta oxidation. And the body will store toxins in fat. So when you increase metabolism of fats, this will release these toxins. And if a person is not exercising, if they're not consuming enough water, the toxins get backed up in the lymphatic system, and now a person can experience a headache, nausea, fatigue. This is called a Herxheimer's reaction, but it's simply a negative consequences of detoxing too rapidly. So the patches should be removed, and the person should consume a lot of water. But yes, absolutely, the patches definitely trigger a detox effect.
What is the difference between, is the healing crisis and retracing different than the detox effect?
Yeah, we refer to this as a healing crisis or a Herxheimer's reaction.
So, two more questions, and then we can pretty much call it done. People are asking about the heat. How much heat can these patches, if we mail it? What is the heat thing? And then why does the crystals lose its charge, or how do they lose its charge, or how come it's not charged long? So
yeah, so first of all, preferably the patches should be stored at room temperature. Now, years ago when we got started, we were confronted with this problem. So we added in glycerin into the patch. It acts kind of like a natural antifreeze, and it protects the patches during shipment, and allows the patches to last long enough once you apply them to the body. Normally, the organic materials, the crystals that are in the patch, they would degrade in the presence of body heat. And in fact, the patches are designed to trap body heat. So if you were to take a infrared thermometer, you could actually see that the patches are, the temperature of the skin is warmer under the patch than it is out in ambient, and this is activating the patch. So the patches can last up to about 24 hours or so, but a person definitely does not want to leave them on that long. They could get a heat rash, but also the patches need to have a on-off cycle. So the patches work when you stimulate the skin, but if you leave it on too long, the body stops responding.
awesome. Thank you.
You wear the patches, so the X39 and glutathione, let's say you wear in the morning, and then let's say you wear an Eon at night. They have different 12-hour clocks. Is that correct?
Well, when you say different 12-hour clocks, so the example, it would be a perfect way to use the patches using X39 glutathione day, Eon at night. They're different wavelengths of light that are stimulating the body. So the body's not going to adapt or accommodate to it. So that's why we recommend 12 hours on, 12 hours off, so the body will respond to the products.
But you can wear different like you can wear X39 during the day, take it off at night, and put your Eon at night on and take that off during the day. Is that correct?
Absolutely. Yes, that's right.
Got it.
Yeah.
Peter, are there any other questions on chat?
That's
Good.
it. Let's just move forward now.
Okay, so David, we want to really thank you so much for coming on and just sharing your wisdom and your knowledge. We really are in gratitude that you spent that time with us. And Peter, David already explained the product. I don't think I need to do that. So why don't you just tell people how they can get it?
Everyone, if you just love what you heard and you just like to participate with us, there's only 2 ways to join us. You can come in as a customer, order this at retail. We don't want anyone to pay retail. Just click on the auto ship button and get it at wholesale price. If you love to share this with the world, just come in and pick up with any of our 5 different packages. You can get it all at wholesale price. The more you buy, the more LifeWave gives you for free to lower the price below the wholesale cost. And you get a free website, get a free app, and you get this all amazing support to help build your future together. So David, thank you so much. All 330 of us here today on this webinar, thank you for your time, your experience, and what you have created for worldwide humankind, for us all to enjoy and to really share and regenerate and repair ourselves for the rest of our lives. So thank you so much, David.
Thank you, Peter. It's been a pleasure. And many thanks to you and Marci. Really appreciate being on and getting this time to spend with your team.
Thank
Okay.
you.
Thank you.
You're welcome.
So,
Thank you.
so
Bye,
we'll
everyone. Big,
Thank
big,
you.
big bye to
Bye.
David.
David.
Thank you, David. Wow.
Thanks, everybody.
Thank you. Wonderful.
Bye. Thank you.
We're so blessed.